This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wisi.org.
It's spring. Well, thanks everybody for being here today. Today we're announcing an exciting new partnership between the Department of Health Services and the Office of the Commissioner of Insurance. Our goal is to make sure that health coverage is more affordable and accessible to all Wisconsinites. Earlier this year, I issued an executive order, the fourth one, which charged the Department of Health Services and Office of the Commissioner of Insurance with implementing plans to, quote, enhance affordability, access, and consumer protection. This partnership is rooted in this mission. Now, of course, we have seen that Medicaid expansion improves the private market in states that have accepted the federal expansion. In fact, a recent report released by the Office of the Insurance Commissioner found that the individual market premiums were 7 to 11% lower in states that expanded Medicaid compared to those states that did not. In Wisconsin, under my Medicaid expansion proposal, we have the opportunity to expand coverage to 82,000 people and make sure that health care is more accessible and affordable. This is an important first step to improving access to quality, affordable health care in Wisconsin. We know that we can do more to strengthen the individual market and bring down the cost of care. The partnership between OCI and DHS will focus on boosting enrollment and outreach efforts, improving coordination between and among state and federal agencies, and promote programs that support working families to gain access to care. These actions will expand on the work that was initiated under the previous administration and bolster efforts within and outside of our own departments. Under this partnership, DHS and OCI will collaborate with community partners who have dedicated countless hours to helping individuals and families find health care coverage that they need. I'm grateful for the work of the insurance agents, navigators, certified application counselors, and others who have built up an enrollment infrastructure in Wisconsin. DHS and OCI will support and enhance local efforts to increase enrollment in marketplace plans and Badger Care, especially for those that will become newly eligible under the expansion. Once again, I'd be remiss if I didn't remind everyone of the opportunity we have in front of us. Expanding Medicaid brings an additional $1.6 billion to Wisconsin to help address some of the critical access shortages. In 2017, there were approximately 230,000 uninsured Wisconsinites between the ages of 19 and 64. And we know that many of these people, particularly low-income people, have fluctuating incomes, which means they bounce between Medicaid and the marketplace. Getting our two agencies to work together to help ensure a smooth transition into private insurance and keeping a robust insurance marketplace vibrant will benefit all of Wisconsin. Through Medicaid expansion, one, we can bring $1.6 billion in federal funding to Wisconsin. Two, improve the private marketplace. Three, lower premiums. And four, cover more people. It's time to get this done, folks. With me are Andrea Palm from the Department of Health Services and the Commissioner of Insurance, Mark Afable. We are here to be here and happy to answer any questions you might have. Folks, come on out. Go ahead.
Thanks for the question. So irregardless of what happens with the Medicaid expansion proposal, while we will continue as a priority and to push it in this budget cycle, these two initiatives are not mutually exclusive. They build on each other. They're both necessary to improve the marketplace and coverage for Wisconsinites across the state. And so we will push them both together forward, but can operate them independently if need be. So our first piece of business is to convene and formalize what has been the work of stakeholders around the state already in previous years to improve enrollment. Mark and I will co-chair that group, and we will, as I mentioned, we will formalize it, and we need to really talk with those folks about what kind of resources might be necessary, what resources are already available, and how to double down on the work that needs to be done to improve enrollment and in both the marketplace and in Badger Care.
Other question?
So again, the Medicaid expansion is a top priority for us, and we will continue to push for its inclusion in the budget. As it relates to the partnership between OCI and DHS, there is good and important work that needs to be done to improve access to both programs, individual marketplace insurance in high quality coverage in the individual market, as well as access to Badger Care. And the governor mentioned there are particularly those folks in the 100 to 200% of poverty level that move between the two programs, that move from private insurance to Badger Care and back and forth. And that's about their incomes and how they qualify and don't, and from month to month, shift workers, direct care workers, child care workers. These are the folks that end up falling through the gaps when we as a team, as an administration, are not focused on ensuring that those folks can access the coverage that they are eligible for. So one of the prime targets, one of the prime places where we are going to bring resources to bear, where this partnership is most important, is in that window between 100 and 200% of poverty, between 100 and 138% of poverty under expansion, to make sure that those folks who are eligible one day for marketplace coverage and the next month are eligible for Badger Care because of changes in their income don't fall through the cracks. And that is where I think you will see the most intense and important focus as it relates to what the state of Wisconsin brings to the table to build on the really important work that our stakeholders in the private sector as well as private insurance has done to enroll folks in coverage.
And I'll just add one other thing here. Of course, we are going to continue to push for Medicaid expansion. As I indicated, there's some extraordinarily important reasons why we are doing this. But not, even it's important for those in the on private plans. It costs less in states that have taken the Medicaid expansion for health in the private health care or health insurance in the private sector. 70% of the people in the state of Wisconsin have indicated in the most recent poll that they support Medicaid expansion. We're going to continue to fight for that. The cooperation that's going on between these two important agencies, representing different sectors of the healthcare community, are really important regardless of Medicaid expansion. But their work will be much more productive and much more relevant to the 70% that said yes, we want Medicaid expansion, but more importantly to the people of Wisconsin that want affordable and accessible health care. Well, we're taking this opportunity to expand outreach on our own. Clearly, I can't imagine the legislature or the leaders in the legislature are going to oppose us working together to make sure everybody can find their place in the healthcare world. So we are informing them via this event, but also we'll continue to talk to them about Medicaid expansion.
So the governor mentioned the number of uninsured between 19 and 64. Overall, in the state of Wisconsin, there are about 290,000 folks who lack health insurance coverage. Some of them qualify through the marketplace, others for employer-sponsored coverage, and others for Badger Care. I think obviously it's the goal of all of us for everybody to have access to affordable health insurance and to be covered, to be healthier and more well, and that obviously drives down costs for everybody. But we will drive as much as we can, as much progress as we can to reduce the uninsured rate as low as we can here in Wisconsin.
Mark, do you want to respond?
Yeah, I would just say that a major piece of this initiative is the education and making options available of coverage. And so we're going to continue to promote that. We're going to see what is available for the marketplace to expand coverage for all different insureds and make sure that there are all different options available to consumers.
We're looking for the opportunity to see the entire budget first before we make any claim as to what we're going to support or not support. Certainly, so we haven't seen the entire budget, and we're going to be looking forward to that day when we can see all the different issues. But clearly, the people of Wisconsin told us during the campaign to fix the damn roads. Now, if the Republican leadership has an idea as how we can magically do that without increasing the gas tax, we'll certainly be looking for that. But it has to be a sustainable future around this issue of finding money to fix our damn roads. So we're looking forward to the entire package, not just the transportation package, but the entire budget. So before we can respond whether this is a good idea or not. And frankly, it's not soup yet either. So it's hard for me to respond to something that we don't know what the soup is. We've talked about the need for expansion, and we've talked about the need, or that they have this need to not have it. So that's that primary discussion point. Now, how their attempt is to backfill any of these areas, these critical areas around mental health and behavioral health and issues around opioids, and making sure that healthy moms and healthy babies program exists in the state of Wisconsin. That I don't know how they're planning to do that, if they're going to do it at all. So the bottom line is it's pretty simple. If 70% of the people say expansion's a good place to be, we were just up in Stevens Point last week and we heard it loud and clear. We still will be fighting for that expansion because it is the easiest route, it's the most effective route, and it's a route that will use the federal money that the people of Wisconsin have already paid for. Thank you. Have a good day.
Thank you.